Presentation for our group project regarding a proposed nursing research study for our research class at King University. As our topic, we chose to identify the barriers that prevent associate degree or diploma nurses from seeking a BSN or advanced degree. Our team members include Cynthia Adams, Donna Boxell, Martha Harris, and Thomas Talley. When we first started exploring possibilities for our research study, we started by examining the literature to see if there were improved outcomes associated with a BSN degree. There was an overwhelming amount of data to support this. So then we asked ourselves, why do more nurses not pursue their BSN degree? That became the basic concept of our study. So why are we concerned about this topic? Because of the improved outcomes that are associated with nurses having an entry-level BSN degree, the Institute of Medicine has recommended that 80% of RNs have a BSN degree by 2020. That cannot be achieved just through traditional BSN graduate programs alone, but that will require diploma and ADN nurses to obtain their BSN degree. And at the current rate, that will not happen. Better trained nurses will improve patient outcomes and help uplift the profession of nursing. So the goal would be to make the BSN the entry-level degree of nursing, and we wanted to explore the barriers that would prevent these diploma and ADN nurses from obtaining their BSN degree. To explore this question, we chose a descriptive correlation quantitative design. This type of study will identify a particular situation, then it will identify a particular problem. It's useful when little is known about the phenomenon. It will ask exploratory and explanatory questions like why and how, and the factors related to the problem in the question. There's no manipulation of dependent or independent variables, but instead it seeks to identify correlations between the variables. And the goal with this type of study would be to gather information and make observations that can then be used in future studies.
Hi, I'm Donna Boxell, and we have developed our hypothesis as a group to say that motivation is the #1 barrier that prevents ADN and diploma RNs from completing their degrees. We used the PICOS design that showed that the population of non-bachelor science nurses, that's non-BSN nurses of diploma or ADN, that were employed in a hospital within a 50-mile radius were considered for a survey to determine what was the #1 barrier to not completing their BSN. The intervention would be to increase the BSN nurses to 80% by the year 2020, which is recommended by the IOM for patient outcome improvement. Our comparison was improving the patient outcomes by BSN compared to non-BSN nurses. Our outcomes was the increased number of BSN RNs and the escalation of nursing as a professional science. Study design was a descriptive correlation quantitative design. To discover the best ways to motivate these ADN and diploma nurses would be necessary to help to improve this quota that is required by the IOM to pursue their higher education, to improve patient outcomes, and would be best for the profession to be seen in a more professional light as a science. The study approval would come from, of course, the Human Subjects Research Committee at King University. That would be #1. The area nurse managers, of course, the IRBs from any of the institutions that we use within a 50-mile radius of Knoxville, Tennessee. Of course, it may take months to obtain final approval because if we were just using 1 or 2 units, we could begin our research immediately. But it would limit us to the type of quantitative study. It wouldn't be on a grand scale. We would, of course, exempt certain people from our survey after the first 3 questions were answered as far as age and their degree. If the BSN degree had already been met, then they would be eliminated. And if they were over 60, they would be eliminated because our group decided that people over 60 who have been RNs for a while would be looking more to retire than to go on for their BSN. And of course, anybody that worked less than a year would be exempt because we didn't feel they'd have the knowledge to participate in this type of survey. So nurse managers from every hospital were involved in this study.
Hi, I'm Martha Harris, and I'm going to be reviewing the ethical concerns, the theoretical framework, and the literature review of our study. We are not conducting a experiment, and we're not, having to deal with any ethical concerns because our surveys are anonymous. They are going to be coded on the education level of the nurse, and this will allow us to exclude any BSNs or above and provide statistical information on associate degree nurses versus diploma nurses. Since the surveys will be anonymous, we can share the information with the DONs and the IRBs without giving any critical or personal information. For the theoretical framework for our study, we used Leon Fetzinger's theory of cognitive dissonance and cognitions or beliefs or options. There are psychological conflictions when it comes to those, and they can cause feelings of unease. And that can be one reason that non-BSS nurses don't seek out their BSN degrees. We're also using Kurt Lewin's change theory. And in that theory, he states that change does not take place until forces that facilitate the change overcome the forces that oppose the change. For our literature review, we perform literature searches on ProQuest and on CNOM, also known as the Cumulative Index of Nursing and Allied Health Literature. We use keywords such as RN to BSN, RN to BSN education, RN to BSN barriers, facilitators, and motivators. And each research topic was based on the practice of nurses, evidence-based practice, best practices, and patient outcomes. The big thing we found was that there was big gaps in research. There weren't any quantitative studies, and most of them were qualitative. And so we weren't able to get good. Using qualitative, we wouldn't be able to get good numbers. We also found that the area of other studies were not really focused in this area of the country. And so that's why we're focusing on the Knoxville area and the 50-mile radius around that, and also doing quantitative.
My name is Thomas Talley, and I'm going to be discussing our sampling methods. So for our study, we chose to look at nurses in a 50-mile radius of Knoxville, Tennessee, and we chose to sample nurses that worked at hospitals. We figured this was a great way to get a large number of nurses, and it would be feasible to get approval from the director of nursing or the nurse managers of that facility. We really wanted to limit it to nurses that had at least a year of experience, but less than 60 years of age. And our survey questions would include questions like what level of nursing are you at, ADN versus diploma nurses, their age group, and how long have you been working as an RN. So for our data collection method, we decided to use an online survey. We'll be utilizing SurveyMonkey, and that will allow us to simply send a link to each survey participant that they can respond to. This would allow us even to collect data like, for example, based on a facility. We could look at all the nurses at a particular facility thought and how they answered their questions. We're going to use the Likert scale, which utilizes a ranking of 1 to 5. And this will allow us to perform parametric statistical analysis, and we want to limit the survey for about 2 weeks. Leave each survey open for a 2-week period. The resources that we need will be very minimal. Basic office supplies such as a computer, internet access, printer, paper, pencils, gasoline for travel. If necessary, we can contract a statistician, but at this point we don't foresee that. And on this screen you'll also see a list of our references. As mentioned before, we retrieved our references from ProQuest and CINAHL, and you can look at those. And that's it. So what we hope to gain from this survey is we really want to delve down and to figure out why nurses are not going back to get their BSN. At this point, based on the literature that we've looked at, we don't think we're going to hit the IOM's goal of 80% BSN nurses by the year 2020. We really want to develop policies and procedures and really get all the stakeholders involved so we can reach that goal. We don't believe this will be the definitive research, but we believe that this will allow others to build upon this research so that we can reach that goal of by 2020, getting 80% of nurses to get their BSN level. Thank you very much.